This is Ed and Pat Sanders saying hello and welcome to African American Health Matters.
Critical numbers of African Americans are dying from prostate, breast, lung, and colon cancer because it's been treated too late. Even more African Americans are affected by diabetes, Alzheimer's disease, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we are still needing continuing education and more about HIV/AIDS. Our surveys show we need more ways to access resources available in our community and nationally.
There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. And Ed, we need to educate our people about the importance of clinical trials. African American Health Matters is a mobile health, text message, and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. And now we have African American Health Matters on Cyberstation USA.
It's health tips for remembering to take your medication and tips on handling everything from diabetes, hypertension, and to tips on losing weight and breaking those bad habits.
You can register online to receive health text messages by going to www.africanamericanhealthmatters.com. That's all one word, www.africanamericanhealthmatters.com. Or you can call our 1-800 number, 1-800-677-8441, and someone will get back with you within 24 hours to get you registered.
Weight and health go hand in hand, and that is why your weight matters. Go to www.yourweightmatters.org. Diabetes health. Regular visits to your eye care professional is a must to prevent problems that can lead to blindness. Hypertension health. A great way to lower your blood pressure and combat the corrosive effects of plaque buildup is to exercise. Arthritis pain. Don't just sit there, exercise. The best time to exercise is when the inflammation has already calmed down. Heart health. If you have a dog, think of the dog as an exercise machine with fur. A brisk walk is good for both of your hearts. Heart flutters. Your heart needs vitamins and minerals that aren't in our diet. Magnesium, calcium, iodine, and B-complex are 4 heart supplements.
The Patient Advocate Foundation CEO and President, Nancy Davenport Ennis, personally became involved in legislative reform when a close friend, Cheryl, was not only battling cancer, but also her insurance company, which refused to cover her clinical trial treatments. While her friend Cheryl bravely fought for her life, Nancy, with help from the Virginia Task Force for Insurance Reform, worked on reforming coverage for cancer patients. In 1994, the task force was victorious with the passage of Virginia House Bill 240. But Nancy didn't stop there. She founded the Patient Advocate Foundation. All of these cases involve patients with chronic, life-threatening, or debilitating conditions. Some need help taking on their insurance company. Others have no insurance, while others have coverage but need financial assistance to buy medicine. None of these clients will ever have to pay for the help they receive from the Patient Advocate Foundation. And the foundation is able to successfully resolve more than 98% of the cases it takes on.
Well, when patients call PAF, oftentimes they have a myriad of issues that they're faced with. What they can expect from us is comprehensive, individualized services designed to help with their immediate need and also identify future needs that they may have as they move through illness back into good health. Our case managers are highly trained, they have diverse backgrounds, and when a patient calls our 1-800 number, they're immediately connected to a live case manager. The case manager does an initial assessment of their needs. We fill in an intake form where we capture all data necessary to work their case, and then that case is assigned out to a case manager based on area of specialty that will work with that patient from initial intake through full resolution.
When people call us, they're desperate. Every avenue available to them to solve the problem has not worked, and it's their life that they're fighting for. And at the end of the day, you're going to battle to save your life medically, but we don't want you to have to battle to save your life financially and to feel that you're losing all of your integrity and your hope because you can't get the financial issues solved or an insurance issue solved. We can do that for you.
It's very important that the people in this country realize this organization exists and that they know how to get to them, how to contact them, and get the help they need.
For more information, please visit us at www.patientadvocate.org or call us at 1-800-532-5274.
Today we have with us Dr. Mark Clanton. Dr. Clanton is the Chief Medical Officer of the High Plains Division of the American Cancer Society. He is former Deputy Director of the United States National Cancer Institute at the National Institute of Health. He served as the Chief Medical Officer of Blue Cross Blue Shield of Texas and has been honored with the Secretary of Health and Human Services Distinguished Service Award as well as the National Institute of Health Director's Award of Merit. Dr. Clanton is a voting member of the Food and Drug Administration Tobacco Products Scientific Committee. He is a member of the Washington University in St. Louis National Council for the Institute of Public Health, where he advises the Institute on the development of a full-time school of public health. Welcome, Dr. Clanton.
Hello, Dr. Clanton.
How you doing, husband Ed?
Good. How are you?
I'm doing fine.
Good.
We sure appreciate your taking out on your busy schedule because we hear you're backed up real back far.
Well, it's a crazy time. I just dropped off my oldest son at the Naval Academy in Annapolis.
Wow.
Yeah, so we spent a week up there, dropping him off and getting my second one to look at colleges on the East Coast. So it's been wacky, I tell you.
Hey, that is something. Well, we've been there, done that too. But not Naval Academy. That's fantastic.
That's great.
Yeah. I'm just so proud of them, and it's just an amazing experience.
It certainly is.
It sounds like you got your broom and you already swept yours out the door.
Yeah, ours are gone. Yeah, well, we didn't want to take a whole lot of time. I need to get a sound check for you. So are you on a speakerphone?
Actually, I'm on a headset, but that's what I had to do.
Okay, do you have a speakerphone?
I do not.
Okay, that's okay. We're going to headset. Let me make a little adjustment on the sound here. Just sort of do a couple of a paragraph introduction of yourself, if you could.
Okay, well, I'm Dr. Mark Clanton. I'm currently Chief Medical Officer of the High Plains Division of the American Cancer Society, and I'm here to talk about how we can all get involved in the cancer prevention study number 3.
All right.
Okay.
Well, why don't you tell us a little about that?
Sure. A lot of people don't know that the American Cancer Society is actually doing important research in cancer prevention for a long time, actually since the late 1950s. And we wanted to understand how things like lifestyle and environment and nutrition impact our tendency to get cancer. And so, again, back in the early 1950s, we started our first population-based study, which became the Cancer Prevention Study number 1, CPS number 1, which provided important information that helped us understand that tobacco smoking causes cancer. And so that was quite a long time ago. Since then, we've had Cancer Prevention Study number 3 that involved 1.2 million Americans. And that study gave us some very important information about how being overweight can increase our chances of dying from cancer, believe it or not. So here we are today, now with Cancer Prevention Study number 3. And we're looking for 300,000 people to participate in this study. And this is unique because it wants to understand how we eat, what choices we make concerning exercise, and other lifestyle choices interact with our own personal DNA to either increase our risk of cancer or protect us from cancer in some cases. So this study wants to understand how an individual's DNA, that source for heredity,
Right.
it is involved with the things we do after we're born. You know, we're born with our DNA, but believe it or not, the DNA does interact in a way with what we eat, what choices we make in terms of our lifestyle, and of course how much exercise we get. CPS3 is going to help us understand that important question.
Oh, that's really interesting. Now, we were attending a cancer program recently, and the doctor said that if everyone follows their health rules or follows the diet plan for preventing heart disease, that if they do just that, they could actually prevent cancer as well. And I noticed that you mentioned overweight. Can you get more in detail about that?
Yeah, that's a great point. I mean, being overweight, and we're talking about severe overweight, really sits right between the diseases of diabetes, heart disease and stroke, and many kinds of cancers, specifically cancers of the intestinal tract, like colorectal cancer. So there is a clear connection between being overweight and being overweight for a long period of time. In the occurrence of cancers and diabetes and heart disease. So I think what he was talking about is anything you do that would reduce your weight and reduce your risk of those other conditions might reduce your risk of cancers.
Yes.
And you should jump on that right away. Well, what do you mean, Dr. Clanton, might?
Yeah.
The reason I say might is because what we know with certainty is that if you never become obese, your risk of dying from cancers like intestinal cancer and esophageal cancer, maybe even breast cancer, actually aren't very high and don't go up. So we know with scientific certainty that if you never become obese, we know that you can modify your lifetime risk of cancer. What we don't know yet is if I can take an obese person and move them back to a normal body weight, we just don't yet know what that means for cancer risk. But what we do know is we can immediately reduce your risk of heart disease, and we can immediately reduce your risk related to diabetes. So the good money's there. If I reduce my weight, I'm benefiting in many different places, and I might also benefit in terms of reducing my lifetime risk of cancer.
Dr. Clanton, we know how very important cancer is, and when you mention the word, a lot of people kind of tense up, but just tell us, can injuries and stress actually cause cancer?
Well, certain kinds of stress may be related to the incidence of certain kinds of cancer. But I've been asked this before, and what I always want to remind my audience is that if you look at the most powerful causes of cancer, those things that contribute mostly to cancer, stress is going to be pretty low by itself on the list.
Okay.
If you want to know what are the most powerful causes of cancer, we would then have smoking tobacco as number one.
Right.
Probably followed, believe it or not, by obesity, and then followed by a list of infections that can cause cancer as well. So stress in some studies can contribute to the incidence of cancer, but it is very low down on the list compared to things we absolutely know with certainty increase your risk from cancer.
Does alcohol fit in that category as well?
Absolutely. Alcohol certainly does. In fact, if you can combine some risk factors like drinking alcohol to excess, smoking at all, and things like being obese, you can dramatically increase your risk for cancers of the intestinal tract again. Smoking, of course, by itself is a high risk for lung cancer, but when you combine alcohol and smoking together, those dramatically increase the risk of cancers of the food pipe, the esophagus, the back part of the throat, and the airway, as well as cancers of the stomach. And in fact, my own father passed away because of cancer related to the stomach, and he was a heavy smoker. So smoking by itself is a problem, and of course when you mix that with things like alcohol, it also dramatically increases the risk of those kinds of cancers.
And if you're obese and you drink and smoke, you are just almost doomed there.
Well, I don't want you to be doomed. I think that's what educating ourselves is really all about. There are things you can do to stop smoking, and we know that. We can help you if you're ready to do that. I myself have had a lifetime battle with weight, and so I'm working daily, trying to eat in a reasonable way and also, get my body moving.
Yeah,
So there are things you can do about these conditions that do drive cancers in our community. Things you can do about your weight, things you can do about smoking, and of course, it's just always a good idea to drink in a moderation. And not to excess.
Right. Now, since we're on obesity, and I too have fought obesity in my childhood and part of my adult life, and finally kind of got it under control, but as I know, that once you're obese, you have that fat mentality, so to speak. And we also know that I don't know if it's 50%, what percentage of our Americans are obese or overweight. And this really causes a problem. So I kind of wanted to kind of put a pin in obesity. Tell us some of the things that, we know we need to walk and we need to do those other things. But can you get a little bit more into how obesity actually is one of the cancer-causing problems?
Yeah, I think one of the most important things is it's about getting moving. Our workspaces, our play spaces today are all built and designed in a way to prevent us from burning calories. Those spaces are all designed and sitting for most of the day, barely moving sometimes in front of a computer.
That's true.
In some places, people can't even walk up and down the stairs from floor to floor because even some of those doors are closed and not available. So the truth is anytime you can walk, you can walk during the day or get up from where you are and move around, you're burning calories.
Right.
And that is a wonderful start at changing not only how you feel, but it's a wonderful start at changing that sort of calorie equation. You cannot burn calories sit still. I know it sounds silly, but you can't.
Yeah.
So
no, you can't.
Getting moving around, and what I do want to tell you is you don't have to run 3 to 5 miles a day. What you really want to do is be able to walk for 20 or 30 minutes a day.
There you go.
That's right.
And if you want to know how many steps, we can tell you that too.
10,000, right?
If you can get 10,000 steps in, get a little pedometer. Some places they give them out free. If you can walk your 8,000, 10,000 steps per day, that's equivalent to being on a treadmill.
That's right.
For 30 minutes.
That's right.
So walking is more important than we can possibly imagine.
Yeah.
If we just started to walk,
that's right.
Then we could begin turning the tide on obesity and turning the tide on being overweight.
Yeah.
Which is something really important. That mentality, once one becomes obese, there's a mentality that goes along with that.
That's true.
Moving can change that mentality.
That's true.
Because you know this from your own experience.
I do,
I know this from my exercise experience. Once the body is in motion, it really wants to stay in motion.
It wants to stay in motion. Yeah, we got...
Now, if we're assuming we're not having joint problems and all that other stuff, the body in motion wants to stay in motion. And the real challenge is to get moving.
How is that working?
Yeah. Cancer study prevention number 3. First of all, I want to say why it's so unique. It's unique because this is one of the few ways anybody can participate in research. that will benefit our knowledge about cancer. Most research studies are limited in their scope, and you have to be referred into the study and you qualify for the study. This is a study where you can say, okay, if I'm between 30 and 65 years of age, and I personally do not have cancer right now, and I'm willing to participate in a long-term study such as this, then you can choose to be part of this. And that's one of the important things about CPS 3, or the Cancer Prevention Study number 3. So they're going to look at you for 20 years. By the way, I'm enrolled in this.
Oh, good for you.
So as an African-American, my genes from the blood they took are in this study. So they're going to contribute to our understanding of how lifestyle and genetics and behavior interact with each other. And that's another important statement for African Americans.
Absolutely.
African Americans typically do not participate in many of these studies that are designed to develop drugs to treat our cancers, to find better ways of diagnosing our cancers, and to contribute to our understanding of prevention. We typically don't participate.
No, we don't.
That's right.
And if our genes are not part of those studies, then the answers that will come from those studies may or may not be relevant to us at all.
That's right.
So you can choose to participate in this. You can then contribute your uniqueness from a genetic perspective to this, and we'll follow you for 20 years. And all you have to do is fill out a survey once every 2 years on how you're doing, what you're eating, what medications you're on, and that sort of thing. And it's all completely confidential.
I've got a half a dozen people that I need to refer to this. Is there an 800 number for these trials?
Actually, it's fairly easy. What you can do is, for those people who have any kind of internet coverage, you can simply go to the American Cancer Society website and search CPS3, and it'll bring up how you can get involved in your location.
Oh, I love that.
Because we do enrollment based on location. And simply by going to the American Cancer Society website and looking up CPS3, it can give you all the answers about how to get connected, how to enroll, is it being offered in my area, is it being offered in my area, and that's really, really helpful. So cancer.org, www.cancer.org. And when you get there, there's a little search place, and you just put CPS3 in, and it'll bring up the states, and you can tap right into your state, and it'll give you information about where it's being run and how to participate. Part of it is historical as it relates to the Tuskegee experiments. Part of it is just a general suspicion of the medical community in general. But let me just say this, particularly about cancer. Virtually all cancers are a result of DNA that is broken, damaged, doesn't work properly. If all cancers are at some level about our own DNA and about our own genetics, if we are not participating in the research on cancer and its connection to genetics and DNA, it means we're choosing not to have any solutions that are viable.
That's right. That's exactly right.
That's right.
That's exactly
I think you're right. We need to there's a healthy skepticism that's appropriate about research. Any question is a legitimate question.
That's right.
It should be answered by those doing that research. If they won't answer them or can't answer them, then you don't need to participate
That's right.
in that trial. But do not dismiss without any present thought or forethought about the potential values of contributing your DNA and your genes
That's right.
to research
That's
that
true.
could be relevant to you and those like you. I don't think that's right. I think we need to be more thoughtful about that whole process.
I agree.
But there are good reasons why many Americans or African Americans do have concerns about the research enterprise.
That's very good, Doctor. One term that comes up a lot, and I want you to explain this to our audience. What is meant by early detection?
Well, let me propose it this way. So there are three ways that we think about cancer or any disease. So there is primary prevention. In primary prevention, you are doing things or adopting behaviors or practices that will prevent that disease from occurring at all. That's primary prevention. Secondary prevention is where you start looking for an illness that may develop as early as possible. And as a result of finding that illness early through screening, you have a better chance of curing it or controlling it altogether. Tertiary prevention is usually traditional medicine in some way. You know, you've got the disease and now we're trying to treat you and save your life. So with primary, secondary, and tertiary prevention, you can begin to understand screening and early detection. Screening, early detection are about secondary prevention, finding the disease as early as possible so you can either cure it or, in fact, change the course of that disease. So early detection examples are like mammography. Another powerful example, in fact, maybe one of the most powerful examples of secondary prevention and early detection is actually looking for colorectal cancer. Because in many cases, you may have a polyp that is becoming a cancer. If the doctor finds that polyp in your colon and removes it, you've actually prevented the cancer altogether. It's primary and secondary prevention all wrapped into one.
I agree.
Preventing the disease from happening, but you're doing it through early detection. And so, whether it's colonoscopy or using a card, looking for blood, or mammography, and now we're learning a little more about lung cancer and the potential to find that early. Early detection is about finding that disease early, curing it, or preventing it from progressing to the point where it cannot be treated.
We want to thank our sponsors, Dendreon, American Medical Systems, Sanofi Aventis, Genentech, and C.R. Bard.
Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyber Station USA.